We are live now. Tanvi.
Good afternoon and a warm welcome to Expo Talk series. My name is Akil Rashid. I will start today's session and introduce the speaker. Jammu and Kashmir Policy Institute has initiated the Expo Talk series to engage experts, changemakers, pioneers from various walks of life to understand the dynamic context of implementing the UN Sustainable Development Goals on its agenda. The vision and intention of the Expo Talk series is to source inputs and recommendations from experts in various fields pertaining to different sustainable development goals through one-on-one dialogues. Today's session is a part of the Expo Talk series on Sustainable Development Goal 3, Good Health and Well-being, and the impact of COVID-19. We have successfully concluded 18 sessions in the series with a focus on SDG 3 and 5. Today, we are delighted to be joined by Dr. Feroz Ahmed, who is a visiting researcher at Institute of Cardiovascular and Metabolic Research, University of Reading. He's also visiting researcher, vascular biology, St. George's University. We believe his vast knowledge and experience would be highly beneficial for our audience. On behalf of the entire team of JKPI, I welcome you. Thank you very much for taking the time to be with us. Now I would like to pass on the mantle to Tanveer. He will facilitate the session.
Thank you so much. Thank you, Akil. A very good afternoon to one and all who have joined us here on the live page. So as Akil already gave introduction about the speaker and the expert talk series, so we'll be straightly jumping out to the discussion session. So first of all, as we all know the topic today, it's increasing cardiac attacks in youth of Jammu and Kashmir. So first of all, we know that Kashmir is witnessing a steep surge in the sudden deaths due to massive heart attacks. So let's straightly jump to the first question. Let's ask Dr. Feroz, what are the major causes of increasing cardiac attack cases among youth?
Thank you, Akil. Thank you, Tanveer, for inviting me. To answer your question, I can give you a brief discussion, like reasons about why cardiac attacks happen in general, and then I can specify on certain points which are related to the youth these days, which are very common, not even in Kashmir, but like other countries as well, especially in Western world as well. It was always like a primary problem faced by older adults, where we would see some having cardiac arrests or heart attacks. But recently there's been like more and more attacks in the younger population, especially under 40s. And it's estimated that about 1 in 5 heart attack patients are younger than 40 years of age these days. But the alarming thing is that these heart attacks have become more common in young adults, especially in their 20s and 30s. So if you look at pathologically, one of the main reasons for heart attacks is diabetes. And there's again a trend with people having, young people being diagnosed with diabetes as well. It's one of the risk factors for early heart diseases, especially in adults, but more and more young adults are having it as well. Younger population is having diabetes as well. The second main reason for heart attacks is hypertension, which could be either pathophysiological or it can be psychological, especially in terms of stress or mental health issues as well. And the other reason for heart diseases is obesity, overweight, and it plays a key role in heart attacks as well, which is related to basically sedentary lifestyle, which is, I'm a Kashmiri, so I know how lifestyle in Kashmir is, and also related to the unhealthy diet as well. There's even in Western world, there's one reason which has always been linked to most of the diseases, and that's like smoking, cigarettes, or now vaping as well, which has become a new trend as well. That's again a risk factor for heart diseases, and we know for a fact that like I think every 1 in every 5 Kashmiris smoke cigarettes, especially in winters as well. And I've been reading about reports about there's an increased use of illegal illicit substances which youth are using as well. So I could use that. That takes a toll on your heart as well. Specifically, heart disease in young adults, which is basically called premature heart attacks in young adults. The one thing where we see where we have like cases where healthy adults are dying of heart diseases, and it would be mostly related to their family history. And I think there is this culture in Kashmir where you're young and you think like there's, or anywhere in the world, is that you feel you don't have a disease, you're young and you'll be okay. And one of the reasons for that could be atherosclerosis as well, which is a disease where the cholesterol or the fat gets deposited in your blood vessels, especially the blood vessels which supply blood to the heart. And the other reason for premature heart attacks in young adults could be hypertrophic cardiomyopathy, which is generally seen in athletes as well. We've seen cases where young athletes die like suddenly on a football pitch or on a track, they suddenly have a heart attack. And that's related to their heart becoming bigger due to the constant training. The heart muscles become thicker because they have to, the heart has to pump more blood because they are more muscular and more active. The other reasons are coronary artery abnormalities, which could be genetic and from birth defects as well. There are arrhythmias, which could be like there's another disease called which is an arrhythmic disease, is Wolff-Parkinson-White syndrome, where the heart has an extra electrical system which bypasses the normal one and causes arrhythmias in heart as well. The other one is virus-related, which is called myocarditis, where a virus can cause inflammation of your heart and then ultimately lead to heart attack in certain people as well. So these are kind of like major risk factors which are involved in young adults around the world, and I don't think Kashmir is an exception to that as well. So yeah.
Very well answered. जैसा कि डॉक्टर साहब ने कहा कि अंडर 40 जो एज ग्रुप है, एक 1 in 4 दैट्स 25% ऑफ जो हार्ट अटैक्स होते हैं, इनकी जो रीजंस होते हैं इनमें से जैसे डायबिटीज, हाइपरटेंशन, ओबेसिटी, लाइफस्टाइल चेंज और फैमिली हिस्ट्री, इवन की जो एथलीट्स का केस डॉक्टर साहब ने बोला, इट्स very very important to be discussed. So in future talks I hope that we'll keep only this one topic to be discussed. Okay, so as we all know that COVID-19, which wreaked havoc on the whole world since its outbreak in 2019 December. So my next question to you, Dr. Feroz, is what has been the impact of COVID-19 on the increasing cases of cardiac arrest among youth?
There's generally a trend of increased effect on heart due to COVID, and that is if you're either infected or not infected. If you had a COVID infection, it can have effect on your circulatory system. For example, it can cause blood clots, and a lot of blood clots have been reported around the world, and deaths related to blood clots. The virus can cause damage to the blood vessels, either directly by the virus or as a result of body's like immune system response to the infection. It can also cause heart rhythm disturbances if it's affected the heart muscle. The COVID-19 has been shown to cause heart rate to become fast and irregular. And that's partly because your lungs are primarily affected, which supply oxygen to the rest of the organs in the body. And so if you see heart as a constant pump and it needs oxygen 24/7, and if there's a drop in any oxygen level, it has to work faster to supply oxygen to the other parts of the body as well. COVID infection has led to it's been shown to show inflammation of the heart muscle and lining. And there's another another disease which has been linked to the COVID it's called broken heart syndrome, which is also called the Takotsubo syndrome. And it normally happens when the left side of the heart rapidly changes shape and becomes larger. What that does, it weakens the heart so that it's less able to pump blood around the body. It often occurs in response to an emotional or stressful event as well. But in many cases, like the heart recovers really fine as well. In terms of other than the people who had infections and people who haven't had infections, the lockdowns due to the COVID-19 means that people are not able to leave their homes. Young adults who actually are active are suddenly stopping going and doing their physical activity. And so it just makes it a bit difficult to kind of like keep fit, and sitting at home 24/7 also increases stress, which has also been shown to affect the heart directly as well. So there's no doubt been increase in cardiac events. And other factor is that mostly I think there's a window of about 15 to 20 minutes for a heart patient to be taken to the hospital. And due to the COVID, most of the hospitals are overwhelmed with COVID patients. So, and then a lot of people like avoid going to the hospitals we're supposed to save you, partly because the reason they think they might die of COVID. And ultimately, if they have a cardiac event, it becomes difficult. And then, yeah, they might die of a heart attack.
To add to this answer, एक research हुई थी University of Frankfurt, Germany और Journal of American Medical Association ने एक collaboration में एक research की थी. तो ये पाया गया था कि जो 78% of जो COVID-19 cases है, they had damaged their heart. इनको मतलब heart में issues हुए थे COVID-19.
Yeah.
तो और एक surprisingly most of the patients in this study had not required hospitalization for their COVID-19 disease.
Yeah.
So this study also noted that significant signs of heart damage were found in younger, non-hospitalized COVID-19 patients.
Yeah.
Yeah. So by this, yeah.
So I have a friend who works on cardiovascular diseases, especially the effect of COVID on heart cells. She works at Washington State University, and she's recently found that how this virus is able to get into the cardiac cell, the heart cell, and damage it. The reason for that is there's a receptor which the virus uses to attack the cells. It's called an ACE receptor, and it's found on the heart muscles as well. So when the virus is infected, it goes into your circulation. It can bind to the receptors on the heart cells and then invade the cells and especially start killing the cells as well. And yeah, so if you have COVID infection, you're more likely to have an effect on your heart as well.
Yeah, so we can also say and spread the message that the ones who have recovered from COVID-19 should get hospitalized to get checked, to get a checkup of to get screened for the damage of the heart after recovering from COVID-19. Okay, so next question. Yeah, so next question: is there any relation between mental illness and cardiac arrest? How it impacts one's health?
As I mentioned earlier, stress is one of the like factors which leads to heart attacks as well. And a stress can come from either it's a physical stress or a mental health stress as well. And I think that there's research that people experiencing depression or anxiety, or for that matter, PTSD due to war or due to political situations in certain areas of the world, and specifically in Kashmir as well, where we know about 70% of the people are going through PTSD. There's a certain psychological effect on the body because of that, such as it increases cardiac reactivity. So if you're basically in flight and fight mode, which is induced by stress or any of the mental health issues, what it does is your heart rate is constantly higher because you're dealing with that stress or fight and flight response, which basically leads to increased blood pressure. And that means the heart has to pump more and more blood. There's heightened levels of a stress hormone called cortisol, which has been associated with, if you have high cortisol levels, you have higher blood pressure, which basically, if your heart is already due to family history or you due to genetics or even through any disease already have a heart problem, that is going to be very detrimental to your heart as well. And the one more reason for effective mental health issues is that psychological effects can lead to calcium buildup in the arteries. And what that does is the arteries become a bit stiff. And then, for example, if that affects the blood supply, arteries which are supplying blood to the heart, which are called coronary arteries, they become stiff. The blood supply to the heart is affected as well. So, this is how the psychological problems lead to mental health issues, lead to cardiac events as well. More so, I'm not a health expert, but I am a researcher, so I kind of like look at the reasons why it happens as well. So that's why I gave you a couple of reasons. For example, increased calcium buildup in the heart muscles or in the blood vessels as well, which can lead to disease as well. So there's a general trend, and it's kind of like a other way around as well. If you have had a cardiac event before, that can lead to mental health issues as well. So it works both ways as well in that respect.
Thank you. I'm sure this information will help a lot of people. So before we move ahead, we have a question popping up on the Facebook page that, as you mentioned, that that many times disease is hereditary. So can we say early diagnostics or tests could help in identifying the cases? Could you please discuss this further?
Yes, I was going to mention that as well. So I think living in Kashmir, our health system isn't that efficient where a young person can go and get screened, because I think it's in the culture as well. But if you had a family history, if somebody in your family has died of a heart attack or any cardiac event, be it your uncle or be it your any other close family member, and has been like in whatever age they have died of heart diseases, you're more likely to have a heart disease as well. So I think it's a really good idea to get screened earlier on. A lot of these diseases, for example, which are genetic, are not diagnosed until they have an event. Most of the diseases have either damaged heart or damaged or a change in the genes in the arteries. What that does is, you don't know you have a heart condition unless you actually have a heart attack. So I think the one thing I would say is, if you have a family history of heart diseases, get your heart screened every day. It just means a single ECG where they look at the electrical signals. Just get screened as well. But if you have a genetic basis where a lot of people have died of cardiac diseases, I think that's a good idea to just get checked.
एक अच्छी लाइन बोली है डॉक्टर साहब ने, जैसे कि you don't know unless you have a heart attack.
I'm sorry, I missed that.
No, you just spoke about it. So I'm just briefing कि अगर आपके खानदान में मतलब आपके घर में कोई है ऐसा elder जिसको heart issues है, तो it's better to get screened, to get an ECG, so that you will have no uncertainty about your health. Okay, so moving ahead on the policy making, what policy changes could be adopted by policymakers to improve the situation, leading to sustainable change?
Well, I can list a million ones for Kashmir, but I just focus on some of them. I think for any cardiac event or any heart-related event, especially the heart attack, the primary thing should be that you should have emergency responders such as paramedics immediately working on the patient. And I don't think we have any paramedics in Kashmir where they go and check anything or on a phone call or something like. For example, in the Western countries where you call a 999 number here in the UK, and within 10 minutes you will have an ambulance at your door with paramedics. I mean, if not paramedics, I would say if we had first aiders, especially at schools, colleges, and universities, which are trained, and at least to identify that a person has had a heart attack or any other condition. So I worked at the university here, and I still work at the university, and I'm a first aider trained, so I can identify if somebody had a heart attack and what to do immediately. The other thing would be, other than first aiders, have like defibrillators at public places or community centers, or especially at places like universities or colleges or workplaces. What these defibrillators do is they are like little like machines where if your heart stops, it gives electrical signals and starts the heart again. And that's used. You anyways have to go to the hospital straight away, but then you don't die immediately. Like, for example, we've heard cases in Kashmir. I had some family members as well, or some neighbors who straight away dropped dead of a heart attack, and nobody knew what to do. And the problem with heart attack is that it's sudden. It's not like any other disease. Like, even though cancer is the biggest cause of death in the world, but because of heart attacks, if you have a heart attack, you just die straight away. If you have cancer, you still have that window of 2-3 years going through treatments. So I think having emergency responses, or have a policy where you can introduce that, at least in a college or a university, you have to have, in one department, you have to have a first aider and a defibrillator to take care of like immediate use of on a patient. As I mentioned, there's an increased use of drugs in Kashmir at the moment, and I was reading a report yesterday. There's like girls and boys taking drugs in Kashmir as well, which is very, very concerning. And I think authorities need to act tough on drugs and give youth a bit of a direction and have more drug de-addiction centers, and I think that can help as well. Especially, when we talk about working out, people working out or young adults working out in a gym or somewhere in Kashmir, we don't talk about women. So I think it's important to have like community health centers, especially for women, where they're encouraged to do that. Don't call it a gym because it's always like a frightening word. Just call them a health center where they either get screened or get like a regular kind of exercise or some little stretches to do just to get better or like help them get fit. And the other thing would be like per se in Kashmir as well. There's youth engagement by resolving the issues, whatever political issues Kashmir has, because that does take a toll on people. And I mean, I've grown up in Kashmir, so I still have PTSD as well. Even if I hear like a firecracker or Christmas here, I still get like jits of it. So it follows, and so it's just resolution of some issues where youth have something else to do and opportunities come up as well.
फर्स्ट एडर्स और हेल्पलाइन की बात की डॉक्टर साहब ने, जो कम्प्लीटली मिस है कश्मीर में, इवन के कम्युनिटी हेल्थ सेंटर्स फॉर वुमेन, ये सब चीज़ें बिल्कुल यहाँ पे मतलब बहुत कम है, इवन के नेग्लिजिबल. So एक important point जो आपने बात की, increased use of drugs, which has been recently found even boys and girls are actively using drugs and on a large scale, and it's increasing every day.
Yeah.
And the check by authorities is very minimal on these things. Plus, you just added the youth engagement programs, which are very important in this part of world. So before we move ahead with another question, I have my colleague Akil who wants to jump in with a question. Akil, please.
Sir, I believe that you already answered the question that I was going to ask, but I would still like to know more about it. Sir, as you know that a lot of young people who are joining gyms, they believe that doing so will help them stay fit and healthy. And there are others who engage in sports activities for leading an active life. But it has been seen, as you mentioned in the beginning of this discussion, that such people also become victims of cardiac issues, which is worryingly weird. What would be your suggestion to the young people? Should they go for a general checkup before joining a gym or engaging in sports?
I think that's a very good point. As I mentioned, that a lot of athletes, I think it was the Euro 2020 this year, and I think it was Belgian players like had a heart attack during the game. And so what people do here is if you are an athlete, before you take part in any competition, you go through medical tests to make sure your heart is okay, because being athletic or going to a gym puts more stress on your heart, and you're basically training your body to get more blood supply to muscles and basically a healthy heart. And it would be, if, for example, one of the factors I would mention is that if you go to gym and you find that while working out you have like a little bit of chest pain, I would say stop gym and go have a checkup on your heart, because sometimes it could be nothing, but it's better to know rather than being sorry. So I would say suggest that know your family history, because you would know if somebody in your family had any history of cardiac events. And if you want to go and join the gym, it is actually good to do that. I mean, there's not a lot of like heart attacks due to gym, like going to gym or anything, but then if it does, there's always an underlying cause. So it would be basically if you had a family history. So I think it would be a good idea to just get checked beforehand.
Thank you, sir. Thank you. It was really helpful. Over to you, Tanveer.
It was really a very good question regarding the athletes and the cardiac issues. So moving to next question, it's also engaged with youth. So what are the general steps that youth could take to improve their health, and especially during harsh winter? So we are coming here to the winters in Kashmir and to the other parts of the world. So what steps could youth take to improve their health, and especially during the harsh winter season?
I think I can think about two things. One would be don't sit in the hammam and for hours and hours. Get out and still go do your workouts. Go for long walks, and eat healthy food. I mean, we know the food in Kashmir during winter is a bit like rich in carbs and a lot of fatty food we eat during winters as well. So I would say watch your diet and get regular physical activity as well. It may not be ideal during Chalai Kalan, as we call it. The other thing was that there's an increased incidences of people smoking during winter as well. So I'll say mention like stop smoking or cut down on your smoking as well. Healthy eating. I've seen recently when I was in Kashmir last year, there's a lot of fast food chains which have opened up in Kashmir, and I know my family was happy. Like lots of fried places have opened up, pizza places have opened up, and it seems like a good thing. But when I see it, well, having research in cardiovascular events, all I could see is heart diseases. Every time I see a burger place, I just see heart disease, and it's a case here as well. If I see a pizza place, I'm like, okay, that's a heart disease center basically. So I would say it's not eat healthy, and it goes back. If you see the stats of cardiac events in young adults, there are more of them in cities than that in the rural areas. Rural areas have less heart attacks than in the cities, and it's partly because there's a sedentary life cycle, and the food has gotten unhealthy as well. Cut down on carbs. And other thing would be if you feel, I would say the good exercise during winter in Kashmir would be to go skiing in Gulmarg. It's a really good physical activity, and if you haven't skiing before, just do it, try it, and it does work your heart out as well. So yeah, just keep healthy.
जैसा कि डॉक्टर साहब ने कहा कि ज्यादा हमाम पे ना बैठे रहें, जैसे विंटर में मोस्टली लोग खाते हैं। हमाम तो यहाँ कम ही है, लेकिन कांगरी का इस्तेमाल बहुत ज्यादा होता है। तो प्लस डाइट का ख्याल रखें, क्योंकि जो आप बोल रहे हो कि फास्ट फूड्स की चेन यहाँ पे बढ़ रही है कश्मीर में, ज्यादा फास्ट फूड आ रहा है, तो डाइटिंग पैटर्न चेंज हो रहा है लोगों का। फिजिकल एक्टिविटी की बात डॉक्टर साहब ने की, मोस्टली कश्मीर में विंटर में स्पोर्ट्स एक्टिविटीज बंद होती है। यहाँ पे मोस्टली स्पोर्ट्स क्रिकेट, फुटबॉल, ये सब चलता रहता है, या वॉलीबॉल। तो उसके ऑप्शन में आपको स्कीइंग का ऑप्शन मिलेगा गुलमर्ग में या सोनमर्ग। इवन के नाउ पहलगाम इज स्टार्टिंग स्कीइंग एंड स्नोबोर्डिंग, सो यू कैन गो एंड एंजॉय योर डे आउट देयर, and it will also take very good care of your health basically. So to add to this, a survey was conducted by, again, this Journal of Medical Association Cardiology in Sweden. So on a sample size of 274,000 people, they found that the heart attack was getting worse when the temperature was below freezing point. So mostly in Kashmir we have temperatures below freezing point, and mostly in the Chilai Kalan. So what are your views on that, the temperature below freezing point?
I think so during winter, so the temperature is freezing as well. It means if you go outside, your heart has to work a bit more to supply, pump blood to keep you warm basically. And there's also that your blood vessels can get a bit constricted due to cold as well. So which means that your blood supply to heart or blood supply to other organs, for example brain, is hindered as well. And it again goes back to if you already have an underlying disease, underlying condition of heart, and then winters can make it worse as well. So I'll say just keep warm your body, because if you let your heart, because your heart is the organ which keeps your body warm basically by supplying blood. And so I would say just keep yourself warm, and just don't go outside in the cold that much. I mean, which sounds a bit cliche because you still have to go and do exercise, but you can do it out inside the house as well. But there's evidence that cold can do that as well to you as well. And the other thing would be during winters, because the days are shorter as well, it also affects your mental health issues, because if you have a shorter daylight and vitamin D, which you get out of sunlight, which your body produces because of the sunlight, that can also affect your body as well, because if vitamin D levels have been shown, if they're low, it can cause depression as well. And if you see countries, for example, Scandinavian countries, where the daylight it's like you get 3 to 4 hours of daylight during winter. So you get less vitamin D, less sun, and there's a lot increased suicide rates in those countries because of that depression as well. And it's, yeah, Kashmir also gets like less light during the day in winter as well. If you get your vitamin D levels checked as well, if you're low, just take supplements, I would say, but don't take them without a doctor's prescription or something like that. Yeah.
You very rightly said, shorter day and longer sleeps.
Yeah.
So before we move again, I have my colleague Aksa who wants to ask a few questions or maybe a question. Aksa, please.
Hello, sir. So I have this question somewhere when you were discussing about all this, you have touched upon this, but I would still like to ask this question. So you mentioned that stress is also one of the major causes of getting the cardiac issues. And we have seen that the psychological issues, maybe it is related to trauma or stress or anything, or the ongoing conflict or the disturbed situation in Kashmir, it is causing, it is affecting people and especially young people more psychologically. And as you mentioned that it impacts your mental health, and of course when it impacts your mental health, it does impact your heart as well. But a lot of people do not know that how to tackle that, so they keep on thinking about it. They feel that they are depressed, they're upset, they're sad, but just do not know how to deal with it, and then one day boom, they have a heart attack because they thought about it so much. So how do young people in Kashmir deal with that? Because I feel that there is not much information about it, not much sensitization about it in Kashmir. And I'm not a Kashmiri, but I have seen people around and I have been talking to some young Kashmiris, and this is a major problem. So what is your take on this?
I think, yeah, you're right in that. So I would say talk to somebody, and for talking to somebody, you need to talk to a professional, I would say. And if you're facing through mental health issues or any kind of like domestic violence, which can lead to trauma and or emotional effect, psychological effect on you, I would say talk to a therapist, like, talk to somebody, a professional who can help you guide through that. Because anxiety and depression are very, very difficult diseases, and it's good to get a diagnosis and speak to people who are professionals. And for that matter, you probably need more not psychiatrists, but psychologists to talk to. And I don't think there's a culture in Kashmir, from a personal experience as well, where we have professional psychologists where you can go, because any mental health issue, really, I think it's a generally a South Asian problem as well. People don't want to talk about it because they would be used terms like you're crazy or you need a psychiatrist rather than a psychologist. So I think there needs to be a differentiation of that, where you talk to a professional psychologist for any of those issues. And I think if there's increased incidences of that, I think the authorities probably need to take that into consideration as well. Include more clinical psychologists, in community centers, and where people can go and talk.
Thank you very much for answering that. That's absolutely right, and I feel that not a lot of people are aware that when they feel these kind of things, they should talk to somebody. So I think they should do more awareness, and you have rightly pointed out. Thank you, sir.
Thank you, Aksa. So we have one more question popping up on Facebook. It's Bhavna Misri asking, hello, doctor. How healthy do you consider the traditional Kashmiri habits, especially the voracious eating of red meat? Does it contribute to heart disease? It's a very important question because Wazwan, you all know, it's almost all red meat. So it's a very important question.
I mean, there's a tactics how to eat Wazwan. You just pack it and take it home and eat for a couple of days. But there is an increased like incidences of how much meat we eat as well, especially red meat as well. I mean, I don't think we eat a lot of red meat, but generally meat. I think we need to include more vegetarian dishes in our food. But yeah, I think it would be a humongous task in Kashmir not to eat waswan or any kind of meat dishes. I still So I think people need to think about it themselves. Like if you have any cardiac issues and you go to wasban, not to eat a lot of it. I mean, I'm not saying you can stop yourself from eating all of it, but just do it in limitation, how much you can eat. But yeah, I think and these traditions are always are difficult. And I can give an example of which is a very great example of controlling cardiac diseases. It was done in Finland in 1970s. So there were 2 areas in Finland which had the highest cardiac mortality rates in the world, and the government was getting really concerned about it. And then they figured out the reason for that was a lot of Finnish people eat a lot of pork and fatty food as well. So what the government did, they did a study in these 2 areas where they increased the prices of the meat to, I think, 10 times and reduced the prices of the vegetables by about 10 times. So which basically forced people to take more vegetables and then less meat. And I think in 10 years' time, in a decade, the cardiac mortality was as low. They are one of the healthiest people in Finland at the moment, especially because the government took an initiative. So yeah, if you ask people not to eat it, that's a bit difficult. But I think there's a regulation, you might be able to deal with that additional problem.
Yes, it might be very hard to adopt these practices here in Kashmir. So we have one more question. Since you are a researcher, I would like to ask, do we have sufficient research in this area of cardiac arrest among people, especially young people? So what needs to be done to improve the current situation?
As I said again, if you're a young adult and you have a family history, I would say go, get your heart checked occasionally. Like you don't have to do it once, but you can do it once in a year. Get an ECG, and before starting, if you suddenly, because I know Kashmir doesn't have a culture of physical activity a lot. Not generally, people do it, but not everyone. And if you do start physical activity because you're worried about your weight or you're worried about your heart, and health in general, take it do it in moderation to start with, and look for signs. For example, if you go for like a 1 kilometer run or a walk, and if you find any tightness in your chest or any pain in your chest, that should be a warning signal for you that something is going on, because you're putting stress on your heart immediately. So I would say look for signs in your heart, or like in your body as well, and just get checked as well. I mean, there's research that a lot of it is genetic related, but like as I mentioned, like a lot of athletes have issues as well, which again go back to if they had any family history about that.
So before we move to another question that's on the Facebook page, one thing I want to mention about the data here in at least here in Kashmir, I'm talking about Kashmir. So since we have had a lot of heart attack cases here in Kashmir since last few years, but there is not even you can't find data on the internet at how many cases in this year, in this calendar year. So what are your views on that? Who has to go for that?
Most of the data should be with the governments. For example, here in the UK, there's a constant there's a constant database of how many people die of anywhere in the Western world anyway, and it's always taken up by hospitals or through industry-sponsored research, because in these countries, for example, the data you have is also sometimes backed by the pharmaceutical industry, so that they can target what's happening and produce more drugs as well. But I think I was actually looking for studies. There was a study by Skims, which was done in 2007, and there hasn't been another big study which isn't published. As I was looking for data, what happened, how many cases are dying of Kashmir. But I think the government can take an initiative. For example, there are research institutes which can do it and keep a database of how many people are dying of heart diseases. And it always lies with, because we know that the tertiary care hospital in Kashmir is skin SORA, which I think does keep a record of people. But then if people die in a community center of cardiac disease, it's never taken into account into the system. So I think there should be an efficient system of keeping a track of how many people are dying of heart diseases and the reasons for that as well. The other thing I would say is because the more data you get is through, for example, if a person dies in Kashmir, we don't normally go for autopsy. Even if you die, for example, in Western world, anyone who dies has to go through an autopsy to see what the cause of the death was, and then it gets recorded properly. So I don't know how that will play in Kashmir, but yeah, just from diagnosis, even after death or during life, that's recorded properly on a database. That would be kind of a step forward to that.
Database management की बात की आपने, it's very important and it needs to be done here in Kashmir, at least in the government hospitals, or the government should itself go ahead with this.
Yeah, it's not difficult. It's not difficult because I've seen the data. Government has been keeping track of the COVID patients which are dying and how many in each district are, like how many active cases are. They publish it every day, so it's not they can't do it, but it's just it needs to be done.
Yes, very good example. जैसे कि गवर्नमेंट कोविड केसेस आज हर डिस्ट्रिक्ट में, इवन के हर टाउन में कितने केसेस है, कितनी डेथ्स हुई हैं, कितने रिकवर हुए हैं पेशेंट्स, कितने वैक्सीनेशंस हुए हैं. तो ऐसे ही हार्ट अटैक्स का भी अगर गवर्नमेंट चाहे तो आराम से कर सकती है डेटा कलेक्शन. So before we move ahead, my colleague Aksa wants to move in for another question. Aksa, please.
Yeah, thank you, Tanvir. So I have a very simple question. So there's a lot of use of fatty food in Kashmir. So as we have discussed earlier, you were also mentioning, and somebody also asked this question, that red meat, and then there's Vazwan, everything is fried and too many spices. So a lot of young people in Kashmir who wish to switch to some healthy options, but if you go to some urban areas, some metropolitan areas, they have all sorts of healthy options. You go to the grocery stores and they would give you all sorts of fancy healthy options to you that you can eat this and that. But in Kashmir, there are not many options for it. So I just want to ask that not just young people and anyone who wish to switch to a healthier diet to maintain their heart health. So what do you suggest it how they can do it? And for that, something they do not have to approach to a fancy supermarket to buy those. So what could be those simple things, simple dietary changes you recommend?
I think there aren't many options, and I think you struggle in Kashmir if you have to find a healthy diet. But then if you look at, for example, the diet Kashmiris have, is generally have rice for lunch and rice for dinner. So I think that is, and I think I've recently seen that a lot of Kashmiri houses, rather than the way they used to traditionally cook rice, has changed. They use rice cookers now, which is not a really good idea, because it keeps that starch and the fat still inside your rice. So you should cook your rice properly and go back to the old times. So drain the starch out of your rice. Don't use rice cookers. That's what I would say. About your healthy diet options, I would say include more vegetable-based foods, salads, which I know salads will never be welcome in Kashmir as such. But I think the more young generation becomes food conscious about their food, I would say don't go to these fast food chains which are opening up in cities. Just eat a lot of greens, like even if you do eat a lot of like fatty food, I would say include do an equal amount of exercise to burn that fat as well. So that's what solution is. And I follow that personally as well. If I ever have a pizza, I just go to gym for 2 days straight away to burn that out. But so it's a psychological. So every time I have to order a pizza, I think about what I need to do and burn it. So I think it's a personal choice at the end of the day. If you do make it clear, I think I've introduced it in my home. Every time I go home and I force my mom to eat salads, but it just needs that willpower to do it. I mean, there's lots of fresh vegetables. The good thing about Kashmir is that everything is fresh. Vegetables are fresh. You're not living in a big city where the vegetables have been lying in the supermarket for like days. You can walk to the vegetable market and get like fresh vegetables for your salads, or even if you want to cook them, boil them, you can do that. So yeah, I would say just include more greens in your food.
Those are very good suggestions. Thank you, sir.
Yes, Aksa, really very good suggestion. जैसा कि डॉक्टर साहब ने बोला, राइस कुकिंग की बात की डॉक्टर साहब ने, ट्रेडिशनल तरीका जो यहाँ चावल बनाने का था, that's almost disappeared. So राइस कुकर्स की जो बात होती है, मतलब इट्स I don't know if मतलब टाइम कम लगता है इसमें या it's whatever, but so it's better to switch to traditional ways of cooking rice. And as Dr. Saab ने बोला कि कश्मीर से हो तो take advantage of fresh organic greens. So go for more greens, avoid fast food, and take salads. So we have Akil who is having some question to be answered.
Yeah, thank you, Tanveer. So my question is, again, it's a very simple question. Like, a lot of people are used to, they have this good habit of going for morning walks. Like they don't prefer to miss it even during the harsh winters. So given the temperature in winters, it's really cold in the morning. And is it advisable to change the schedule of morning walks during the months as it stands in summer months? Do such people who continue to go for morning walks in the winter months, so are they advised to, would you advise them to change the schedule of their morning walks or not?
I don't think so. I think if you have a routine of going on a morning walk every day and you know that it works for you, I think you should continue doing that. But if you know that you have an existing condition, I would say speak to your personal doctor you have and see how it's going. And I know there are other factors related to cold in Kashmir. Like, for example, you might actually have a fall on snow or something like that, frozen water or somewhere.
Yeah.
So but I think, but from his personal experience as well, I think people tend to get out of the house for a walk when the sun comes out during winter as well. Like, I don't think anyone's going to walk in a thick fog.
Yeah, sir.
If you go into the park, yeah.
Sorry to interrupt you, sir. But I'm from Sopore, and Aksa is also from Sopore, but she might have not seen it yet. We have a playground in Sopore. It's called Nurga. So you would find a lot of young people playing football. Just after the morning prayers, they go to the ground and start playing football even before the sunrise. So
I think that's a I mean, you see people here playing football 24/7, 365 days away, even if it's raining or snowing in Europe. But yeah, again, you just need to wear proper clothing and everything. For example, you can't wear the same clothes you wear during summer to play football. But again, as I said, if you have a history and you have a problem in your family related to heart diseases, then you just need to kind of be a bit more careful about that. But other than that, if you're healthy and you have no issues, I don't think there's a problem going out and doing what you're doing. The problem is if you have managed that time for an hour to go and play football, and then you go to work after that, if you ask them not to do that, I think probably people stop doing that, and they just kind of has a opposite effect. They'll stop doing what activity they were doing as well. But yeah, again, it just all depends on how well your health is generally. For the sports people, I think it doesn't matter what time of the year you ask them to play. I mean, people here play during midnight as well in winter. But again, yeah, you have to keep monitoring your health in that respect.
Thank you, Tanveer.
So one thing I want to add to Akil's question. So like in Kashmir, we have foggy mornings now in winter.
Yeah.
So in Srinagar, the pollution level is increasing. And if we compare it to Delhi, it's very low. But a morning walk in foggy winter in Delhi. So what do you suggest?
Yeah, I mean, I've noticed that as well. Every time I go to Kashmir, especially Srinagar, there's a lot of like, I mean, it used to be cleaner air, and there's a lot of like construction going on as well at the same time, be it like building the flyovers and bridges. The pollution levels have increased as well. But I think that's a general problem with winter everywhere in the world, where the thick fog keeps the pollution levels low, and if it isn't alarming as it is in Delhi, for example, you get an advisory in Delhi not to go out for days because of the pollution. Um, but yeah, if it does reach the levels where government issues an advisory, then I think that's a good idea to avoid going outside. But there's still a lot of green places in Kashmir. It's not that like if Srinagar outskirts, for example, if you go to like Nishat area and stuff like that, it's still not that polluted generally. So it also depends where you live. For example, if you live near a city center, and then that's a kind of a problem that you have like more traffic, and especially during the winter, the pollution will be more. But yeah, again, if it's the government then comes into play, they might issue an advisory. But yeah, there's a limit to how much you can go out during pollution, for example, in Delhi. So yeah, that is something to be kept in mind as well.
So thank you so much. Very well answered. So we have a question. Neha Purohit is asking, what tests should be included for annual cardiac screening? And how important is use of medication in initial stage if something minor has been diagnosed?
I think the test you can do if you're healthy and you're worried about your health. In general, I would say just I think simple ECG by like every 6 months or every year would be enough to see your heart is working properly. And if you do have any issues, for example, you have high cholesterol levels, which could be generally either familial hypercholesteremia, for example, your family history of high cholesterol, then obviously the go-to treatment for that, which your doctor would give, is going on statins, and to reduce your cholesterol levels in your blood supply. But if you have any heart-related issues, I think it would be a good idea to just speak to your GP, and they might actually recommend you a new medication. I think again, it all depends on if you have, for example, high cholesterol levels, which can lead to atherosclerosis, development of plaques in your blood vessels, and especially in the coronary arteries in your heart, which blood supply, the arteries will supply blood to your heart. Then your doctor will immediately put you on statins to reduce that risk. There's a standard procedure for dealing with those diseases as well, and your doctor should be able to kind of make a diagnosis of that quickly.
Very well answered. As we are running out of time, we have one more question. We see technological advancements helping the field of medicine. Do we have any specific technology or devices that could be useful in tracking or dealing with cardiac arrest, and that is relevant to the context of Kashmir?
I would say there are lots of watches people buy now, smart watches, which can track your heart rate. I have one as well, Fitbit or Apple watches. They constantly monitor your heart during day and night, and then you can get a graph of that on your phone. What has happened if it's dropped too low during the night or gone high during the night. There's like little devices. I have one as well, which is it's like a little ECG monitor where you put your fingers on it and then it records your ECG on the phone. So things like that. For example, it's the simple one. I don't think it's available anywhere else other than in UK at the moment, because it's been recommended by the National Health Services here. Like your GP recommends it to you, and you can buy it for about £190. So that kind of like things like that. There are online apps which track your oxygen levels in your fingers as well. So I think it's just generally just tracking your sleep, stuff like that. So so these smartwatches or these gadgets can always help you track we live in a tech, as it's mentioned, like, in 2021, 2022 soon. We have amenities around us. We have things which can help us monitor our health better, and keep track of that as well, if you're worried about our health in general.
तो डॉक्टर साहब ने एक इम्पोर्टेंट बात बोली, स्मार्ट वॉच की बात बोली, मतलब आप सब यूज कर सकते हो, फैशन के साथ साथ हेल्थ का भी ख्याल रहेगा. सो ईसीजी मॉनिटर की बात की डॉक्टर साहब ने, वो भी यूज कर सकते हैं. एंड देयर आर लॉट ऑफ गैजेट्स व्हिच मॉनिटर योर दिस ब्लड सर्कुलेशन एंड अदर स्टफ. सो we have one more question. Just one second. This would be the last one, I guess. So Manish is asking, how do you know if you are having a silent heart attack? What are those minute signs and symptoms to look for?
I think the first thing would be you will feel breathing issues, breathlessness, and your heart rate will be really high as well. So these are certain things which you should look at. I think if you feel breathlessness or the classical symptom, classical like heart failure or heart attack symptom is that you start feeling pain in your chest and it radiates towards left arm and shoulder, then you should be immediately kind of signal to you that you're having a heart attack. And it normally radiates to the left side of the arm straight away. Any tightness in the chest, or but sometimes it could be nothing. It could just be like a muscle spasm. Sometimes people go through muscle spasm as well, and occasionally acid reflux, silent acid reflux can also lead to heart activation of heart as well. If you had a spicy food late in the night and then you woke up in the middle of the night with acid reflux, that can activate your heart as well. It activates a nerve which can lead to your activation of the heart as well. So I would say eat your dinner a couple of hours before going to sleep as well to prevent that as well. So it's kind of like linked to each other as well.
Just one point I want to take out from your conversation, eating dinner before you go sleep, मतलब इसका ख्याल रखिए कि कितनी देर बाद सोने जाना है डिनर के बाद, क्योंकि मोस्टली यहाँ क्या होता है, डिनर उसी के बिस्तर में जाओ सो जाओ. So please take care. So we have one important question. We have recently seen some deaths due to cardiac arrest, especially in celebrities, men who have died, who have been fit and even runners. Is there something called too much exercise? Also, are men more predisposed to heart issues than women?
I think, I know, there've been issues where you see people, more celebrities, which we call like health. As I said, like they may look healthy and they didn't know they had a disease until they had an event. And again, heart attack is a silent disease because it can immediately come and you can die. There's always a problem. There are certain cases where you don't know the reason why a person died, but if from a research point of view, if a person has died, there's always a reason for that death. If a person has had a heart attack or an event, there's always a reason. When I see from a researcher's point of view, like why it happened, it could be that they already have the heart was healthy, but they had atherosclerosis, like the blood vessels to the heart, the blood vessels were constricted because of the fat buildup in your body, which could be familial as well, which is basically your family history of high cholesterol, which is a genetic disease. If your father or mother had a high cholesterol levels and it runs in your family, it can pass on to your children and to you as well. If you have any of that, then you probably would be put on a statin therapy. But as I say, like people say, healthy heart is always a reason for a death, and it all depends on how they're diagnosed afterwards. The interesting thing about men and women is that women are less prone to have heart attacks up till they reach menopause, and then after menopause, the ratio or the percentage is equal between men and women. And there's a reason for that as well, because of the hormone levels which are in women, which kind of give them protection. For example, estrogen, and also because of monthly menstruation as well, they lose a lot of iron from their body, and iron has been linked to increased levels of iron in your body also leads to increased cardiac events, or especially atherosclerosis. So women generally tend to have less atherosclerosis up to or heart diseases up till menopause.
Thank you so much, Dr. Feroz, for sharing useful insights with us. So as we are running out of time, so I would like to share mentor with my Mr. Akil to present the word of thanks.
Yeah, thank you, Tanveer. Before presenting the vote of thanks, I would like to know about this thing that you talked about, that people should have food, like there should be a gap between when you are having your dinner and when are you sleeping. So
Yeah.
There is this sleep disorder called sleep apnea.
Yeah.
Is it also related to the heart disease? The people who are having this disorder, do they have to be very careful? Do they need to consult a doctor for that?
Yes, sleep apnea is. I should have touched on that as well. It can lead to heart attacks as well, because what it means is that your body is not getting enough oxygen because of the blockage. There's like either your epiglottis, which is kind of like blocking your airway, and there are things which you can do. There are things where you can open like your nose and nostrils a bit more so that the air circulation is constant, or the way you sleep, the sleeping pattern, which position you sleep in. Sleep apnea is dangerous, and it can lead to your heart stopping in the middle of the night as well. So if you have it, there are things that you can use. For example, there's like a kind of like people come up with, like, if it's very bad, you can have this mask of like an oxygen cylinder next to you to make you sleep, to breathe properly, basically. So what it means is that your body is not getting enough oxygen to function properly or normally during the night. And if you have that, then it does include the chances of you getting heart attacks as well.
Yeah, and I have heard it from many people, those who have who suffer from this sleep apnea. They have not been they couldn't identify it as such, like they couldn't identify it as sleep apnea. But how do they explain the condition? So it can be defined as sleep apnea. But sir, and I have seen that for many of those people, changing the sleep, changing the position of their sleep, how do they sleep, it really helps in addressing this issue. So thank you so much, Dr. Feroz. On the behalf of the JKPI and on my own behalf, I would like to thank you for answering the important questions on cardiac issues in young Kashmiris and adding information to the little information that people had about the disease. I believe that more discussions are required to bring more awareness to this growing epidemic. We are looking forward to seeing you so very soon with a new session of the Expert Talk series. And that's all for today in the Expert Talk series. Thank you and have a nice day.
Thank you very much. Thank you very much.